two major things that we need to do, I would say, is one is we've got to protect health workers in communities. Last summer I came home after testing patients. I was volunteering a year ago in a COVID clinic where I was forced to reuse the same gown all day. And when I got home, I didn't want to risk infecting my family. So I took off all my clothes before entering the front door. And I'll say, my children were amused, but I was worried, right? Because the anxiety of being unprotected while caring for patients with this virus is unlike anything else I've ever felt. And it's a fear that I know every health worker feels. And then things changed. I got vaccinated in January before I joined the Biden administration, because I was working on the front lines. I've still had a chance to volunteer to vaccinate others in community centers and in outreach vans, and as part of the efforts here in the U.S. And now I feel relief, right? I'm not worried about becoming infected. I'm not worried about making my family sick. And so free from fear, I can completely focus on caring for the person in front of me. And that idea, freedom from fear, is something every single health worker in every community deserves to feel. We must protect them. And that's got to be urgent now, to vaccinate these health workers so they can get back to the work of testing and treating patients for conditions like malaria, to ensure they're protected with PPE. But we've also got to build the systems in terms of building back better that allow the manufacturing capacity of PPE, the distribution of PPE, to be much more decentralized and localized, so that we're able to ensure that these workers have the PPE they need and the protection they need at all times. So challenge two to me in terms of building back a better health system is to really focus on confronting structural urbanism, is what I call it, is the idea that we are biased against ensuring that rural parts of our world have access to healthcare. That's critical, because not only will we not be able to achieve objectives like ending malaria without reaching the unreached in rural areas, not only will we not be able to reach the goals of reducing maternal mortality or ending HIV and tuberculosis, but it also turns out that ensuring we get care to rural areas is important for the safety of all of us, right? About 75% of new infectious diseases are zoonotic, the pathogens, of course, that leap from animals to humans. And those often emerge in rural areas like tropical forests, where humans are in close contact with animals that they hunt, eat, buy, and sell. And we know in an outbreak, we know this from malaria, that speed matters. We know early detection matters. But if you don't have enough health workers in these places looking for fevers, outbreaks can go undetected for months, if not years.